of years old. So this
Right.
stuff works. It's not just here's another good little coaching tip for you. Just because you hear something for the first time doesn't mean it's different and you don't have to wonder if it works. You have to go to the expert like Dr. Lau and find out for sure, because it might be the first time you heard it,
right.
but it's a fact.
Well, maybe I give you a little bit what you call the my experience, and I tell you why I become an acupuncturist.
Oh, yeah.
Because
Oh, okay.
that would go along with what you said, you know. Because I used to be a clinical chemist working at Sisters Hospital for about 20-some years, and I used to be the laboratory director of the Quest Laboratory, the biggest laboratory in this country.
Yes.
Yeah, the Quest. But then in 1996, when Quest Laboratory in Buffalo, they consolidate with the one with Pittsburgh, so I know it's coming.
Yes.
So I was looking for
Yep.
for a way out. And then, you know, my wife at the same time has tendonitis of the hand. Okay, and she's been going to see a lot internal medicine, orthopedic doctor, and so forth, and yet she cannot close up her hand. And then, but with acupuncture, after a couple of treatments with Dr. King, you know, she's able to close her hand. So that make a believer on me. Actually, I don't even, I'm very skeptical of acupuncture
testimony.
before.
Right.
Wow.
That's
Wow.
a wonderful testimony.
Yeah.
That's the best.
And so before I decided to study acupuncture, I actually went to Dr. King's office on the weekend. You know,
Is that why it's named King Acupuncture?
I bought his
yeah.
practice in
I see.
1999, so that's why I'm still called the King's Acupuncture, and that's why we can still say that we've been in Buffalo for over 30 years.
And I know you love Buffalo because you have a Buffalo
Oh, I
tie
have
on too.
Buffalo tie.
Yes.
Very
so,
nice tie.
So I went to Dr. King, and then I talked to the patient, and then I was surprised that so many patients actually get better without, with acupuncture, and that make a believer on me. And that's why I went back to
Wow.
school for 3 years. I already get my PhD already, but I still have to go back for 3 years. And that's why I get this, so-called Half-Life Champion Award.
Wow.
And
That's
is your-
the best testimony.
We're so
I know, that's
intrigued.
so
It's
exciting.
exciting. Yeah, that's
the
what it
best
is.
testimony when you hear somebody who suffered or who had an illness or who was shown, didn't even believe. I love that, when didn't even believe in it and then saw the results for your own self.
Right.
And then you're just a living
Right.
example of it, because
Exactly.
I'm still trying to get over. I want to see your license when the show's over, because I think you're 50 or 55.
I thought he was 55.
I thought so
wow.
too. Yeah,
You
yeah.
look wonderful.
Thank you very much.
How does your daughter feel about acupuncture?
My daughter.
I'm just curious.
Oh, okay.
that's all.
Well, I'm glad you asked. Actually, my daughter. If you're talking about my doctor, who is the MD doctor, right?
Yes.
Okay. Well, she's one of my first patient. I treated her for the acid reflux because she used to take a Prilosec.
Yes.
Okay, but she's afraid of esophagus cancer.
Wow. Yep.
So I treat her for the acid reflux.
Yes.
And I can tell you that
It helped
right
with that
now,
too.
she doesn't have to take any medication. Now, I'm not saying that I can work for everybody,
Right.
But then but she is the one of the person. She's actually one of my first patients.
Wow.
Oh,
And that's a disclaimer we always want to say too, is that you hear Ava and I talking a lot about different things,
Yes.
and our guests that come on and talk. We are not saying that this is the cure-all, end-all, any of it.
Exactly.
These are
Absolutely.
our opinions. This is
Yes.
the doctor's opinion, and it's our experiences, our testimonies. And if you visit Dr. Lau's website, you'll be able to see all the different testimonies. You'll be able to learn more about him, and you need to give him a call and go and have a visit so that you can start getting off some of that medication yourself too.
Yourself, right.
And I'm just wondering, time is like
Yes, we're
flying
just
by.
running out of time.
My
Yeah,
God, I'm
isn't
glad
it
to
go
be
I
here.
know. Is there something else that we didn't touch that you want to make sure you get in today? Anything specific?
Let me see. Well, maybe you can. Okay, maybe I don't know whether this is. Okay, maybe we say it. Okay, I'm a licensed acupuncturist.
Yes.
Okay, and there's another acupuncturist called the certified acupuncturist.
Oh,
I see.
Okay.
Certified acupuncturist acupuncturists who are MD or who are dentists who doesn't even need to pass the exam. All they need is 300 hours of they can be distant learning. But for me, I get PhD. I still go
Wow, that's huge.
3 years, to study 3,040 hours to be exact.
That's
So
Wow.
that's a difference. So I suggest if you go to see acupuncturist, I'm biased, of course, go to see a licensed acupuncturist.
Dr. Lau, you
Thank
have
you
given
very
us
much.
so much amazing information. And that last thing, I'm so glad that you
Yes.
said that, because that's one of the things that we always say too. Thank you so much for being on
Yes.
our show today.
It's so nice to see you
is that
again.
it's so
Thank you, Roger.
important. It's so important to know who it is that you're going to see. You want people who are experts in the area, who are licensed, and not just somebody
You
who
want to be, in other words, an informed consumer.
Yes.
We are consumers of healthcare. Let's face it, we are.
Absolutely, absolutely. And you want people that are going to give you the best treatment, that have gone,
Exactly.
like Dr. Lau says, he's a PhD holder, and so go to people's websites,
Right.
ask them. Don't just assume because
Investigate.
someone has a little plaque on their wall that they're the best person for you, because you want to make sure who you put your health under, your care, that you're
Exactly.
getting someone who's
Right,
really
it's your body. You're entitled to know.
Yep.
That's a right. It is.
Absolutely, absolutely. So again, make sure that you give him a call, and call all of our sponsors. Support those people who support us, you, the community. And we love to hear from you, so keep those emails coming in and the phone calls. And if you think you may want to be on the show, call Ava or myself, and we'll interview you, send us an information, and see if you might be a fit to help to educate the community too. And we've got a couple of we got one new sponsor too.
Oh,
but
really?
before I tell you about our new sponsor too, we want to thank Mr. Frank's Day Spa. She has been amazing. She went to Europe, and she's got all the amazing, the latest cuts and the colors, and even I
Oh,
keep.
yeah, it looks
You
wonderful.
look really nice too,
Wow,
Ava.
yeah,
There's a
look at
little bit
this,
of
yeah.
blonde in her hair too. So she's got lots of wonderful things going on there. As a matter of fact, you know that I had a pedicure last time I was
No,
there.
I didn't.
And here's another difference, the difference between a medical pedicure and just like Dr. Lau says, someone who just gets a certificate. You can go in.
A medical pedicure?
There's a medical pedicure
didn't know
where
that.
they know the right way so you don't get ingrown toenails.
Oh, really?
And they take off all that dead skin the proper way. There's a medical
Now,
pedicure.
see, I learned something. You learn something new
Yep.
every day.
So call Kim at Mr. Frank's Day Spa and ask her about that medical pedicure, and ask her about the latest trends in hair color and
Yes, from Europe.
hairstyling. And we've got the Healing Spa, where Marge Reed is doing non-surgical facelifts. Can you hear me right?
Non-surgical, yes. Remember, I was in there watching you.
Yeah, you did. You came by. Do
Yes,
I look a
you
little?
did.
Let me know. Am I getting it a little tighter? A little. She does wonderful jobs with facials, and
Yes,
then
she does.
yeah, it was so much fun. And you go in, and it's just so relaxing and wonderful. And she does color and light therapy and essential oil therapy. Thank you, oxygen therapy, and she's a Reiki specialist too. But you
Okay.
go in. There's no surgery. She just used microcurrent. It's a wonderful, fun time, and I'm liking the results. Let me know if you do too. So
Yes.
until next time, support our sponsors. They support you, and stay focused.
Because your health matters.